Dr. Sanjay Oak is an Indian surgeon specialized in field of pediatrics and laparoscopy. He was the former dean of the Seth G's Medical College and King Edward Memorial Hospital in Mumbai. He is also an elected fellow of the National Academy of Medical Sciences, former director of medical education and major hospitals for Medical Colleges in Mumbai. He is a prolific writer in Marathi and a weekly columnist of great repute. Dr. Sanjay Oak was also the Vice Chancellor of the Padmashree Dr. Patil Vidyapeeth, Navi, Mumbai, the CEO of Prince Ali Khan Hospital, Mumbai, and Aga Khan Health Services India. He was appointed as the chairman of the task force for COVID-19 in Maharashtra.
What did Krishna tell to Arjuna? He told, forget all these things. You are a warrior. Today what is expected of you is not to look as to whom the arrow is going to hit. Your role is to release that arrow. Pick up the right kind of astra from your bhata and release it. Hit the enemy. That is your role today as a warrior, as a true warrior. That's exactly the task force did to the doctors. The doctors should continue to perform their own dharma. The whole concept of swadharma came to rescue. Now, sir, I have been a surgeon, and I can tell you that no morning goes away without operating. I'm an honorary professor at Sion Hospital, Mumbai. So I operate there. I'm in private practice, so I operate even before going to Sion as early as 7 o'clock in my own hospital. And I'm operating on all Sundays all across the state doing free surgeries. Why? Because operating is my swadharma. That is what I am. So my friends started asking me, sir, I'm an MS orthopedic surgeon. I'm an FRCS orthopedic surgeon. I'm an ENT surgeon. I'm an ophthalmologist. This is not my role. This is the role of an infectious disease specialist. What do I do today? And I told him, dear friends, before becoming MS, you were MBBS. And being MBBS is your swadharma. Today you need to help your colleagues from infectious diseases, from critical care, Maharashtra, and for that matter, the whole India. These recommendations now we have made to ICMR and MCI, the new council. There are very few critical care specialists, and the branches which we are going to need in the next 20 years is critical care and infectious diseases. So one of my surgical colleagues from UK, British Journal of Surgery, a very beautiful journal which I keep on reading, he wrote a small editorial. And I remember, because see, the theatres were shut, patients were not able to come to the hospitals. So he wrote jokingly that as surgeons, and you know surgeons have their own pride as big as Himalaya. That is the way a surgeon is made. So he wrote beautifully that as surgeons in hospitals we were omnipresent and omnipotent. Today I feel impotent. I remember that line. So I had to tell all my surgical colleagues and other specialty people that, come on, get ready. We need to help our colleagues in ICU. A small thing which we discovered in this pandemic was, if you put the patient prone, there are better chances that posterior aspects of his lungs would get aerated or ventilated. But to make a patient prone, particularly if he is intubated on a ventilator or receiving oxygen, you need a team of 6 to 8 or 10 people. And I said, my orthopedic surgeons and my physiotherapists, you are the best people for such things. And they all came up. So in Fortis Hospital, Mulund, which is reputed for its critical care, we developed the models of such teams. And one good thing in this pandemic was, we were talking left, right and center every night using technology to even the smaller provinces of Maharashtra. Gadinglas, Gadchiroli, Hingoli, Parbhani, Nanded, Amravati, Buldhana, you name a Nagar Parishad, I have spoken to them. You name a small village, I had meetings with Sarpanch of village. and it was a two-way education. I must remember when we were putting across the message of COVID-appropriate behavior and social distancing, came a beautiful dialogue from Fatima B, who was the sarpanch of a small village, and she said, सर जी हमने तो आपकी बात सुनकर अभी निकाह भी व्हाट्सएप पे लगाने की शुरुआत की है. What a beautiful message she got. I mean, I had heard all these days of marriages breaking down on WhatsApp and seen legal cases out of it. But here was a marriage happening on WhatsApp, and that too to respect the social messages of social distancing. So we told the doctors, identify your Swadharma. And it doesn't matter whether you are MBBS, you are BAMS, you are Unani, or even homeopath. Let's all come together. In the initial part of the pandemic, I worked in Dharavi, because Dharavi was the biggest challenge. That's the biggest slum of Asia. And we were afraid that if things spread here, then we had it. So how did I do it? There were NGOs, there were RSS people helping, they were, name a political party, we were all together. But the best part came from BAMS, BHMS and Unani doctors who said, संजय जी शाम को हमारी प्रैक्टिस करने को हमको आज़ादी दीजिए, पूरा दिन हम बस्ती में घुस के सबको आपकी तरफ ले आएंगे. That saved Dharavi from what could have been the worst pandemic release in that particular thing. So the message of this again I think comes from Mahabharata, which says identify the Swadharma and follow it. We all take flights. And one of the initial announcements that the air hostess does is how to brace an impact if there is a disaster, either in the air or on the ground. So bracing the impact was something which is told to us in every flight that we undertake. Here, this was a flight into a completely unknown arena. And even till today, even when the vaccines are around, I can tell you the best way to brace an impact is to wear the mask. Mask, mask and mask. That is the ABC of management of this particular pandemic.
समस्त बंधू भगिनी आणि वारकरी भाविक भक्तांनो, तत्वज्ञ संत श्री ज्ञानेश्वर श्री तुकाराम महाराज यांच्या नावाने आणि विश्वधर्मी प्राध्यापक डॉक्टर विश्वनाथ दा कराड यांच्या अथक प्रयत्नाने साकार झालेल्या या विश्वशांतीच्या घुमटातून भागवत वारकरी परंपरेचा हा ज्ञान विज्ञानाधिष्ठित अध्यात्मशास्त्राचा दिव्य संदेश संपूर्ण मानव जातीला सुख, समाधान आणि शांतीकडे घेऊन जाईल याचा आम्हाला विश्वास वाटतो. जगभरातील मान्यवरांनी गौरवलेला हा विश्व शांतीचा घुमट लवकरच जगातील एक आश्चर्य म्हणून ओळखला जाईल आणि भारताला विश्वगुरू म्हणून मान्यता प्राप्त करून देईल अशी आमची प्रांजळ भावना आहे.